Hi, my name's Fiona Robb. I'm a trainee clinical psychologist at the University of Glasgow, and I work for NHS Greater Glasgow Clyde. So today I'm presenting my major research project, which looks at the implementation of a digital CBT application for insomnia in the context of a first episode psychosis service. So the background to this is that insomnia is a kind of relatively common difficulty with sleep across the population. And the gold standard treatment for insomnia is Cognitive Behavioural Therapy, or CBT. Because there's such a kind of large need, there's nowhere near the number of psychologists required to deliver that therapy. And it's been shown that digital approaches to intervention for insomnia are as effective as face-to-face CBT, so digital CBT. In the context of first episode psychosis, people often experience difficulties with their sleep, particularly insomnia is quite prevalent. And we also know it's related to a higher level of mental health symptoms, so both mood symptoms, but also symptoms related to psychosis. And it's been shown in the past that if we can reduce insomnia and other sleep difficulties, we can reduce these other symptoms without necessarily working directly with them. The COVID-19 pandemic has increased sleep difficulties and mood difficulties across the population, and we know that this particularly affects people who have had pre-existing mental health difficulties. So digital CBT for insomnia is something that could help meet the need for insomnia interventions in first episode psychosis services, particularly at the moment when face-to-face interventions are even more limited than they would usually be. However, we know that just providing access to an intervention like this is usually not sufficient for it to be used. And so what we went to evaluate was how the process of that implementation can work and what the kind of facilitators and barriers to that are. So we conducted the mixed methods evaluation of the process of implementing digital CBTi after Sleepio in the context of first episode psychosis services. And there's three sorts of data that we collected for this. So firstly, what we call implementation data from referrals about eligibility or ineligibility, about how people are or are not using the application, and the demographics of people who are referred to us. We also assessed people's symptoms prior to using the intervention and after using it. So symptoms of insomnia, symptoms related to psychosis, mood, and also COVID-19 related worry. And we conducted interviews with service users and with clinicians prior to and after the use of the Sleepio intervention, so the digital CBT intervention. And these interviews explored kind of contextual mediators and facilitators and barriers to implementation, and they kind of anticipated mechanisms of how it would work. So what I'm going to focus on for this kind of 5-minute flash talk is the interviews that we did with clinicians in the service and what they perceive as the context of the intervention, the facilitators and barriers to its use. So there were 5 categories and kind of 23 subcategories that came out of this qualitative analysis. So we find that, you know, clinicians in the service are very aware of sleep difficulties. They do perceive it as a big issue that they really would like additional information about. But that the sleep difficulties that they see in the service are very complex and very diverse, and that might act as a barrier to an intervention that targets one specific difficulty. They believe that the existing interventions the service has around sleep are sometimes useful, but are essentially not enough or not adequate to meet the need. They believed that the digital CBT app Sleepio itself was helpful and safe, but they were concerned about some potential adverse effects. So for example, increasing paranoia for people, and saw it as something that could be used in their service as kind of another tool in the toolbox in a way that was very much supported by clinicians. In terms of service users factors, they spoke about digital access, digital poverty and digital literacy having a big impact on whether or not something like this could be implemented. And also thought that the individual's kind of stage of their recovery journey and their stability would have quite a big impact on whether or not they could use the app, and a big impact on whether or not they saw sleep as a priority in their care at the moment. In terms of the service and kind of clinician factors that might impact on it. The service at the moment is very constrained in terms of its resource, and they believe that that would be a real barrier to even talking about sleep intervention, never mind implementing something. They saw themselves as clinicians as having very diverse roles, which sometimes means they can struggle to put in particular pieces of intervention. They identified that the service in general really likes to innovate and get involved in research, and that's something that would facilitate it, but that they themselves didn't feel like they knew enough about the application nor had enough familiarity with it to necessarily be recommending it to service users. So the next steps for the project are that our recruitment will continue on through 2022, and we'll try and better characterise the kind of implementation data and also the outcome signals from those pre and post assessments, and develop more understanding of the implementation of the facilitators and barriers of it through interviews with key workers, clinicians, and interviews with service users as well. And I just want to thank my collaborators.